Hello, my name is Joseph Rickert. Welcome to the COVID-19 Data Forum, a series of public webinars and discussions focused on the role of data in responding to the pandemic. This forum is a collaboration between the Stanford Data Science Institute and the R-Consortium. Today's discussion will explore the ways in which data journalists are contributing to combating the pandemic. These include uncovering and vetting difficult to find data, helping researchers explain the relevant science, and producing data-generated charts and visualizations to help ordinary people come to grips with the shape and seriousness of the pandemic. Today, we will hear from three speakers: Mark Hansen, David and Helen Gurley-Brown Professor of Journalism and Innovation at Columbia University, Ana Carolina Moreno, Senior Data Journalist at TV Globo in Sao Paulo, Brazil, and Meghan Hoyer, Director of Data Reporting at the Washington Post. Our moderator today will be Dr. Irena Hwang, a data reporter with ProPublica. Dr. Hwang holds a PhD in electrical engineering, as well as a master's degree in data journalism. Among her work is the May 5th, 2020 article, a comparison of 4 major COVID-19 data sources, which was featured by Big Local News. This article was an early resource for journalists describing how to obtain data from Johns Hopkins University, the COVID Tracking Project, USA Facts, and the New York Times. So we will be taking questions as we go along, and the moderator will decide when the questions will be posed. Please put your questions in the Q&A at the bottom right of your screen. So now, please welcome Dr. Hwang.
Thanks so much, Joseph. It's great to be here. It's great to visit my alma mater virtually, and I'm so pleased to introduce the guests today. So we're going to kick things off with Mark Hansen. Mark is a director of the Brown Institute for Media Innovation and a professor at the Columbia Journalism School, where he teaches data and computational journalism. Before joining Columbia University, he taught at UCLA and was a member of Bell Labs Research. And sorry if this wasn't clear, but we're going to be doing a few presentations first, so we'll kick things off with Mark, and then we'll be hearing from Carol and then Meghan. So Mark, stage is yours.
Great, thank you so much. Let me just cue up my screen here. Sorry, should have been prepared. Thank you for inviting me to be part of this panel. I just had too many screens open at once. All right, we're set. Thank you, Irena, for the introduction, and thank you to the organizers for allowing me to speak today. Or maybe inviting me to speak. Allowing seems like you don't let me out of my cage very often. I'm supposed to be teeing things off and telling a technical crowd a little bit about what data journalism is all about, and then specifically then work toward hint toward some of the work that that data journalists have done specifically around COVID. And then the other two speakers will be reporting more from the trenches, say. I am a professor at Columbia and will give a perspective from having to educate a new generation of data journalists. As Irena pointed out, I am director of the Brown Institute at Columbia Journalism School. We're in fact a bi-coastal organization. The other half of the institute is housed at, I'm going to say here at Stanford, even though I'm sitting on Cape Cod and everybody's everywhere. But I think technically we're supposed to be we're supposed to be at Stanford. So the Brown Institute is half Columbia, half Stanford, Columbia Journalism, Stanford Engineering. And our mission is to explore the ways in which technology and journalism might influence one another, changing the research priorities for engineering and perhaps the practices of journalism. Just to fess up, I am a statistician by training. My doctorate's in statistics. I spent 10 years at Bell Labs, 10 years at UCLA. I've been now 10 years in the journalism school. I'm more a spy in the House of Pulitzer than anything else. But I have learned a lot over the last 10 years. And from my corner of the data world, this is overly wordy, and this is the only slide that will have this many words on it, I promise. But I thought I needed to get it right. Data and data technologies have new social relevance, and almost every aspect of our lives can be rendered in data. These data often tell us stories about who we are and how we live, but because they are products of human attention, innovation, and memory, their perspective isn't neutral, and the stories they tell are often incomplete, open-ended, and biased. Movements in reproducible research and transparency have meant that data are plentiful. Some would argue that data journalism, or each incarnation to date, has flourished precisely because of the prevalence of data about people, businesses, and governments. But in all cases, we also have to mind the gaps. Journalism is called on to combat the misuse or invention of data and analysis, misinformation, a subject under intense scrutiny by the profession at the moment. Data and the networks they circulate across can either reinforce or challenge systems of power. And so in a very real sense, our democracy depends on the public being able to think critically about these technologies, telling good stories from bad. And journalists, as truth tellers, sense makers, and the explainers of last resort, need to understand the workings of data in society and the ways in which data code and algorithm function. Journalists are becoming more and more bold in producing their own data collection and analysis, borrowing widely from different disciplines. We've assembled a powerful toolkit for finding and telling stories with data. These acts of journalism are also contributing substantially to the data literacy among the general public. But data journalism is not in any way new. Pulitzer himself in 1904, in his paper called College of Journalism, mapped out what journalists need to be taught. This, by the way, is the school that I teach in. And he mapped out law and ethics and history, which we all still teach today. But he also mapped out statistics. He wrote, everybody says that statistics should be taught, but how? Statistics are not simply figures. It said that nothing lies like figures except facts. You want statistics to tell you the truth. You can find truth there if you know how to get at it, and romance, human interest, humor, and fascinating revelations as well. I love this quote from him because in this moment, Pulitzer sees tremendous narrative possibilities in data. He sees romance, human interest, humor, fascinating revelations. Of course, there's his adherence to the truth, or his need for the journalist to put truth first. But the idea that data contain contain rich stories about, as I said before, who we are and how we live is quite shocking, especially 1904. And if you think about 1904, Fisher was like 14 years old at the time, so statistics wasn't even statistics. So he might, I mean, I think in the way we're thinking of things today, Pulitzer might be more referring to kind of sort of data and data science as opposed to formal statistical inference, but you get the idea. At Columbia, just to give you again a sense of like the terrain of data journalism for those who don't know much about it, we offer a Master's of Science degree. We also have a dual degree with computer science. So in 2 years, you can get a degree in computer science and a degree in journalism. And I myself teach something called computational journalism in the J School, often as part of a 6-university consortium where we bring engineers and journalists and designers and in total six different departments together from 6 different schools across the across Manhattan. Well, I guess also Brooklyn. The sorts of things we teach, and I apologize that the next couple slides are Python and not R. Actually, the motivation for the teaching comes from the idea or the basic observation that I've made over the last 10 or so years, sort of teaching and refining the teaching, my teaching at Columbia, is that data journalism or computational journalism is not just so much more data analysis. It's a hybrid practice that's steeped in a reporting tradition. And for those of you not familiar with what reporting might mean, I have a quote here from Philip Isle from a piece in the Columbia Journalism Review, where he's reporting he's talking about the act of reporting, and in particular a reporter's notebook. The piece is called Ode to a Reporter's Notebook. And he says, the reporter's notebook is a low-tech device that I use to capture the sights, smells, sounds, feelings, tastes, and other impressions of the world. The piece of this quote that I love is, to report is to be alert and alive in a particular time and place. To report is to be alert and alive in a particular time and place. What this is asking us then is when we're thinking about bringing computation to journalism, we're taking that basic curiosity that we're cultivating in our students' minds. We're cultivating a curiosity about the world, a kind of restless questioning spirit that asks why things look the way they do. And what we're doing with computational journalism or with data journalism is adding computational lines of inquiry to that habit of mind, that questioning of why things look the way they do, and are they fair, and are things working the way they should. So if you take one thing from this presentation, it's that reporting practice as a call to be alert and alive in a particular time and place means for me in my teaching that computation simply extends that alertness and curiosity to the virtual world of data, code, and algorithms. The kind of teaching I do, it's either R or Python, and I happen to have some Python notebooks here. Basic introductions to Python, how the web works, some machine learning, maybe using some APIs, maybe learning a little bit about bots. We're not the only ones doing it, of course. Cheryl Phillips, who I see is in the audience, and Charles Barrett, who is a graduate student at the time at Columbia, wrote a lovely report about teaching data and computational journalism and the state of that teaching in the United States. If you want to learn something about computational journalism, you just missed the NICAR meeting, National Institute of Computer Assisted Reporting, where you'll find topics like visualizing data, using data to report on climate change, finding needles in haystacks with fuzzy matching. You get a number of topics that will, for the technical people in the audience, will resonate with you, but then to think about how to apply that in journalistic context is interesting. At the Brown Institute, we also have an educational mission where we put on events and try to bring in sort of computational ideas to the journalists and have them think about computation differently. This year we sponsored a program called Changing Course, where we had Catherine D'Ignazio and Lauren Klein talk about their new book on data feminism. And Rediet Abebe spoke, who's just joining Berkeley, spoke on computing and social change. We've had events to introduce students to public data, where we had, say, the chief statistician of the United States, the chief demographer of New York City, and then a panel of data journalists. And the day kind of went, we are here to give you data, says the federal government and the state authorities. And then the data journalists are like, nah, not so much. We also sponsored various kinds of partnerships between different groups. In this case, we put out a call for partnering official statistics organizations and journalists to better inform the public. More COVID related, the Institute has spent time trying to figure out how to respond in the way that through the kind of work that we do. One of the things we put on during the sort of the beginning of the pandemic was something called At Home with the Brown Institute, where we basically led computational journalism courses. Here's 2 hours on bots. Here's 2 hours on Unix tools. Here's 2 hours on web mapping. Here's 2 hours on data visualization. Trying to bring these skills mostly to the alumni of the J School, whet their appetites to learn more about computation and bring it to their reporting practices. These are just sort of screenshots of all of the different pieces that we brought together. And then we had a series of micro grants where we tried to pair, or we looked at supporting people to better inform the public about the pandemic and about what it means to them, to the local communities. We had, there were $5,000 awards each, but we had over 325 proposals come in from around the world. And the winners were everything from stories about, say, what would happen if during the pandemic we had major flooding along the Mississippi River, to battling misinformation in rural Southeast Alaska. We also held very early sort of talks about how bringing together epidemiologists and journalists to try to see how we can sort of meld our skills to be able to tell stories and help the public better understand where we are. You know, in terms of the actual reporting that was going on, you'll see this probably more from the next two speakers, but you see these are two New York Times front pages from March of last year, March 20th and March 27th, I think. And you see the kinds of graphics we were starting to look at and the kinds of things that data journalists were struggling to pull together. So we have a series of maps. At that time, sort of bubble charts were a thing. You also see journalists struggling with how to express scale. So this is sort of job loss in the US at the end of March of last year, and trying to reflect scale. And then trying to show what might happen depending on different conditions that take place. As I mentioned before, journalists also spend time looking where there isn't data and trying to places where no one's incentivized to collect data and trying to collect and add to it. So the COVID tracking project is one example that came from The Atlantic. We sponsored a project called Documenting COVID-19. It's an open website that has been doing, the team has been putting together FOIA requests, to Freedom of Information Act requests to state and local health departments and governments to try to figure out, or to try to collect emails among elected officials or government officials who that mention COVID in some way. This trove of documents has been responsible for over 60 stories in various outlets, from front page New York Times articles, in this case about the meatpacking industry and who knew what when, to just last weekend there was a piece in the Chicago Sun-Times about just sort of reflecting on the crisis a year into it, using very local data from the Freedom of Information Act requests that our Documenting COVID project pulled together. Sometimes it's big, sometimes we provide these stories to big organizations, sometimes it's smaller, like the Kansas City Star, when the coronavirus outbreaks at meatpacking plants were made public. And when our time here is finished, you can jump over to look at data journalists who are busy fighting for public information and how Freedom of Information Act requests work. I feel like I must be at 15 minutes, so I'm going to stop now.
Perfect timing, Mark. Thank you. That was an incredibly comprehensive overview of data journalism, especially its practice at Columbia, and having come into the world of journalism by way of a technical field like you, I really love the philosophical quotes that you brought up, which I think help remind me why we're doing what we're doing, especially during a pandemic. So thank you again for that overview. I think next we have Carol. And let's see, Carol, there we go. Cool, we can see you now. Carol is a senior data journalist at TV Globo in Brazil. I am hesitating because Carol, there we go. Okay, it's like we can see her chair, which is also fine. But in case, okay, great, I can see you now. Carol currently produces data-driven news stories for the television news programs and has reported extensively on the spread and mortality of COVID-19 in Sao Paulo, which, as I understand it, Carol, it sounds like, we watch the numbers here in the US. I mean, I'm watching US numbers, but also in Brazil. I guess, first off, how are you doing? I should start with that.
I'm hanging in there. I guess that's the answer. It's been really hard because we've been doing this for a long time, and we've seen the numbers rise and seeing what was going to happen. And now we're seeing it happen. So even in São Paulo, I'm in the largest city. I'm in the state that has the most hospitals, the most ICU beds. In the beginning of the pandemic, we had more ICU beds than Italy, and now we're, completely collapsed. So it's very, very hard.
I feel like I'm sorry doesn't really do enough, but you know what? We're so glad that you took the time to be here with us today, and please take it away. We'd love to hear your presentation.
Okay, let me share my screen. Thank you very much for having me. I'm delighted to be able to share a little bit of our experience in journalism covering COVID here in Brazil. I am not from the technical field. I'm not a statistician. I was horrible at math in school, but I ended up in journalism, data journalism, because I covered education for the TV Globo news website G1 for 8 years, and we have a lot of education data. So that's how I got into data journalism. And in January of last year, I transferred teams, so I came to the television news programming, the local news, specifically focused on data journalism, and now that's pretty much COVID data journalism. So that's how I got into this.
Carol, sorry, 1 second. It sounds like the audience is having a little trouble hearing you. Would you mind maybe moving the mic a little closer to your mouth?
Can you hear me now?
Oh, that's beautiful.
Okay. I'll try to hold the
yeah, I sometimes have to do that too. Thank you. All right.
Okay.
Sorry about the interruption.
So, but that's okay. Thank you for letting me know. Let's see if I can try and put all the information in 15 minutes. Just to let you know a little bit, because you're not from Brazil. So in Brazil, we have a universal public health system that works integrated in all the levels of government. So we have the municipal level, the state level, and also the federal level, which is the Ministry of Health. That's our main authority. But they all work integrated, and each of them have their own responsibilities. So that's where we get the official data from COVID in here in Brazil. But we also have in the pandemic, and also before the pandemic, we've had different. How do I say? I can't. Okay, good. So we've had different here, as you can see on the right, in green, we have different initiatives from researchers from Brazilian universities and universities outside Brazil that have joined up together to build information and knowledge from those official data sources to help fight the pandemic. And we also have, for example, Infogripe was a platform that existed before the pandemic that tracked SARS cases in Brazil. So this is, for example, the first platform where we could actually see the COVID data, the pandemic arriving in Brazil last year. So we have very important data sources, and they're very abundant actually in Brazil. But I'm going to show you a little bit afterwards some of the problems that we've had accessing all that data. We have a lot of information systems in Brazil in the health department, and some of them have were already being used that were created for the pandemic. So these are I'm just gonna go a little bit an overview of the systems that we have for COVID right now. So for cases, we have a system called Vaccination Tracking and also a system that's called Jesus Notifica. Vaccination Tracking is pretty much the main system that we have for data if we want to look at COVID in Brazil, because it also gives us the information about deaths by COVID and also hospitalizations. And for testing, we have a system called GAL that already existed before the pandemic that the public labs use they use it for tracking different tests that they process. And also vaccination, we already had a pre-existing system As you know, since we have a public universal health system, we have a tremendous capillarity. So we have a very strong vaccination program in the country. We have crews that can access all the communities in the country. So that's our strong side. We only struggle with getting vaccine doses. So we can use the whole system that we have right now. But just a quick overview of CVEP-GRIP, which is the main system, the main database that we have. It was created in 2009 after the H1N1 pandemic. So since then, it's been mandatory for every single hospital, be it private or public, to notify the municipal surveillance authorities within 24 hours every time a person with symptoms of SARS shows up at their hospital. So that was a system that was already being used. It was already in place, and it gives us details of each patient. So obviously we don't have access to the full database. We only have access to the anonymous database, so we can't see details that can identify each patient, obviously. But we do have information of how old they are, their gender, their race, the date when they ended up in the hospital, if they went to an ICU bed, if they're under a ventilator, what happened to them if they were discharged, if they died, the tests that were performed, the results of those tests. So that's very useful information for journalism and for research purposes as well. And in the pandemic, because we needed a place to tally the deaths by COVID, this system was already it was also adapted to get all the information. So the surveillance groups, teams, they have to notify this system for every single confirmed death by COVID, even if it didn't happen in the hospital. And SUS Notifica is another important system because it was created in the pandemic to tally all the new cases that we have, even if the person didn't need a hospital. So in theory, we even have information on suspected cases, and if their test came back negative, then we would have discarded cases as well. But we have many obstacles. I'm going to try to sum them up. I'm not going to get into details of those because we don't have time. But if you have any questions, you can ask, and we can go over them in more detail. Okay, so we do have all this information, all this data, but it's not really available in a very effective way for us. For example, all levels of government, not just the federal level, they can have access to a lot of this data, but they won't just share the open raw data. So we can use in a lot of details. So we have some details, other details we don't have. So we have very limited analysis opportunities with this data. For example, this VEP, which is the main one, since it's a node system, we don't have a public API for it, and we only have the raw data once a week. There's only one update a week. That's every Wednesday at 7 p.m. So, for example, in my day-to-day work, if I'm thinking about a story that I want to produce, and it's Tuesday or Wednesday, for example, I say like, I'm going to wait until tomorrow because tonight I'm going to get a better version of the database because the other version is already 1 week old and we have delays in notification. So it's very hard for us to do our job like this. So we have to program ourselves to get the information as fast as possible with the best available information out there. And the SUS, the new system to tally all the cases, it's also very inconsistent because the authorities are overwhelmed. So not all states are able to notify all the suspected cases, for example, or all the discarded cases, for example. And we also have a very, I think it's a very lacking testing strategy. We only test the symptomatic cases in Brazil, so we don't trace the disease. We're pretty much navigating a storm without a compass. We actually saw this new rise that we've had in patients in the hospitals. We weren't able to see it coming before with a rise in cases, for example. The first rise we saw was hospitalization. So that was very hard. And it's very hard for authorities to actually take measures to prevent a hospital system from collapsing, for example. And we also have we have problems with testing. We don't have open raw data about tests that were performed, PCR tests. We don't only confirm cases from PCR tests, we confirm cases from antibody tests. So the new cases aren't exactly active cases. So it's very confusing for us to use most of the data. So we focus mostly on the hospital data because I think it's the most reliable one. And we also have some problems with articulation between levels of government right now, since things are very unstable, and that reflects also on the transparency of those governments, the policies, and the way we can get and use that data. And just finally, I think it's worth noting that in the beginning of the pandemic, around May or June, the federal government was the only source of new cases and new deaths around the country. They were fed by information from the states, but they were the only ones who gathered the whole information for the whole country. And they decided to change the way they were going to show the new deaths. They were only going to show the deaths that were taking place and confirmed within the last 24 hours. And as you know, because we have a delay between the death occurring and the death being confirmed in the systems, that would leave out most of the deaths, so we wouldn't be able to see what was going on in that area. So there was actually a never before seen initiative, what we call a press consortium. So different competing media outlets had to join efforts to get journalists talking every single day with every single state authority to get the numbers of cases and deaths and now of vaccine doses. So we have a parallel tally from the official tally every day, and the parallel tally became our official tally, the one that we use, because we can guarantee that there's no risk of it being changed over time or being limited for us to see what's going on. So I think that's very important. And on the second part, I would just like to show you a little bit of our day-to-day here, working in journalism and television journalism. So every day we have 10.4 hours of news programming, and 4 of those hours are local news here in the team that I work. So we have 3 news shows every day, and we are focused on the state of São Paulo, which is the biggest one in the country, and mostly on the metropolitan area, which is the largest one in the country and the first hit by the pandemic as well. So this is pretty much our team here. We have 17 news producers in the local news team, and I am the one that's focused on the data-driven stories. So we work together to build up stories and tell the stories, and use data to help share that information with the public. So we also have a team of designers and a technology team that helps with automation. And also we have the editors and the reporters that help get the story on air. And the main thing that we need is getting the data fast. So we do have sources of data, but we needed to automate a lot of things in order to get to help the editors and the reporters and the producers to get the information qualified and all the analysis that we have to do. So we automated all of that to help give them some independence. So the rolling average and the trend analysis was something that we started at our local news crew in June 1st, and we've been doing that pretty much every single day. Now, as you can see, yesterday we had a rolling average of 421 deaths every single day in the state of São Paulo, and it's been rising alarmingly. And this is a way that we automated a project. So we just input the numbers, the total numbers, and it already calculates everything and helps bring this screen to the public every single day so they can see what's going on and what's been happening in the past few weeks. We also have indicators for the reopening plan. So the state is divided into 17 different regions, and each region has their own indicators. So this is something that we've worked really hard to make happen. Basically, what we do is we get the official data and we get all those rules. And we built a code to calculate the indicators every single day for every single region, because the government has the rules. The rules are public, but they're very complicated. And the government doesn't show us the indicators every single day for every single region. So we had to do it ourselves. And what we do here, our strategy has been on a daily basis to create dashboards. So every single editor, reporter, or producer can just go on the dashboard and get the most recent data, and also look into the history to see what's been going on, to see if it's a record number, to see which regions are doing better, which regions are doing worse. So that's been very helpful on the day-to-day basis. And that leaves us with time to do more special analysis for special stories of the trends that are going on. So these are just a few examples. For example, this is my last slide, okay? I'm almost done. So this one here on the bottom, in January, we saw Manaus collapsing. So the lack of oxygen, a lot of people dying, waiting for an ICU bed. And what we saw in the CPEP database was a high number, a very high number of patients that were hospitalized in São Paulo, but were residents of Manaus. So we were able to catch this migration in the database and write a story about it and find patients. We actually found a few patients that were illustrating the data, right? They were proving that the data was real. And here on the top, we have the city of São Paulo has a very big and very strong and quick system of mortality information. It's a model system for the country. And so we were able to show that in 2020, 1 in every 5 deaths of natural causes were caused by COVID or were suspected cases of COVID-19 that were never confirmed. We were also able to split the city in different districts to show the risk of dying is a lot higher in some districts, and that's a problem that we have here in Brazil, which is social inequality, and that so we can prove that COVID doesn't affect the rich and the poor in the same fashion. And one analysis that we've been doing since January is tracking the age profile of hospitalizations, because we've been hearing that it's growing among the younger people. And we've been trying to track to see when the data actually shows this new trend, to see what it means. So far it hasn't shown. It's still worse among the elderly, but we've been tracking it every single week to see when we can see that change, so we can inform the public as well. So in my presentation, I left on a few slides with links to these stories if you guys want to see, but that's pretty much it. I think I got 16 minutes. Sorry, Chris.
No, that was perfect, Carol. You're right on time. And thank you for that presentation. I have to say that even though I've been very attuned to data reporting stories about COVID here in the US, I must admit I haven't been thinking a whole lot about or had access to data journalism stories in Brazil. So thank you for that perspective. And so, it was really interesting to hear about the challenges that you faced in Brazil. Some of them we're all too familiar, when it comes to newsrooms having to bootstrap data visualization dashboards, really galvanizing data collection efforts, which is why I am particularly excited to introduce Meghan Hoyer, whom I met last summer when I interned with the data team at the AP. Meghan, who was recently recruited by the Washington Post to lead its new data journalism department, is an experienced data journalist. I can attest to that, having worked at the Associated Press, USA Today, and other publications. Last year, Meghan was part of a team that received the AP Chairman's Prize for their success in improving the distribution of data sets to member newsrooms and bureaus. And that is something I got to see firsthand when I interned there. And Meghan, so yeah, Meghan, please, I'm excited to have to hear about your work again, and I think our audience will be as well.
Sure. Thanks so much for having me. I really appreciate this. And basically I don't have a formal presentation, but I do have, do want to kind of walk through a little bit about what the last year has been like for us data journalists. I think in the US, honestly, our experiences have been very similar to those in Brazil. So a lot of what Carol said rang true in terms of the types of problems we have. And honestly, one of the chief problems we have had in the last year in data journalists has been trying to use data to tell this story as it happens. Most often as data journalists, we're taking data that's been either collected by a private entity, a researcher, the government most often, honestly. And that data is usually shaped, processed, that takes a while to collect. And so there's oftentimes a lag. We're using data a lot of times in our stories that's a year old, 2 years old. Obviously, that's not going to work for us in COVID times as we're trying to get a handle around what's happening as things happen. And so there's a number of techniques and things we had to overcome in the past year. I'm going to walk you through a number of those. The first I wanted to talk about, hold on as I share my screen. The first thing I wanted to talk about is modeling. Very early on in the COVID crisis, what we saw was, in the absence of kind of knowledge about how this was going to go, was just a huge number of models being created to try to predict what was going to happen next and how contagious COVID was, what caseloads would look like, what burdens would look like. It was a little bit kind of what everyone wanted to know, but the problem was as data journalists, we were kind of being besieged by models, honestly. Almost every group, organization, think tank, private citizen was kind of coming up with their own COVID model. This the CDC has ended up kind of compiling these models. And you can see, back in April of 2020, what we were looking at was models with like massively and wildly varying outcomes depending on which model you were choosing to listen to. And it was a challenge for us because as data journalists, we're often pairing with newsroom reporters and editors across the newsroom in a large news organizations like at the AP, which covers the entire world and has reporters embedded in all the states, but also most countries, at places like the Post, where there's lots of journalists across the world as well. What we were getting was reporters in Kansas were choosing one model because that's what their state was looking at, and reporters in Washington state were choosing another model. And those models didn't have actually a whole lot of relation to each other. They both sometimes predicted dire scenarios, but completely different dire scenarios. And it was really hard to vet these models given the lack of true information we all had about how COVID was going to behave. We were kind of operating a little bit in an information vacuum last year. Everyone was about, how it was transmitted, how contagious it was, like who would be affected. Back in April and March, we really didn't know the answers to these questions. And so models were therefore just inherently problematic. And yet they were kind of being forced upon us as a society by all of these different means. And in many cases, honestly, governments were touting them as well. So, as data journalists, a lot of our job is to vet data sources and to kind of think about data that we're using and adhering to in stories. And so early on, we at the AP, I was at the Associated Press at the time, we at the AP agreed and decided that we were not going to use modeling and not going to base stories off modeling predictions and things like that. And it was a data decision that honestly was just made because it lacked at the time the true science behind it. A lot of these models, honestly, were being pushed forward by people who weren't epidemiologists, who didn't have a full grasp of even the science, the disease science, and honestly, it was just too early to know. So in the absence of a lot of case data, which we weren't getting, and in the absence of being able to really rely on models, what did we have? Like, data journalists had to be uniquely, it was a taxing year because we had to be uniquely really, really creative in terms of what we looked at last year to be able to tell this story in real time. So, here are some of the highlights and kind of things I thought were interesting last year. One of the things we saw first when COVID came and first hit in the US, New York City was particularly hit hard. And one of the things we were seeing was lots of reports that Manhattan was emptying out, that parts of Manhattan were empty. That's why we weren't seeing cases there, things like that. And I thought this was an interesting look because the idea is you get a story idea, and then the question is, how do we quantify that? And I thought this story did a very good job at trying to quantify what was happening in New York City with the population changes as COVID struck the city so hard. And so they decided to, as a proxy to people's movement, they looked at garbage pickups. Where was household waste dropping as a proxy for people not living there anymore and having moved out of the city to avoid the virus? And this is a map they made very early on in the pandemic. And I thought it was an interesting way to get at some of the other issues and some of the issues the city was seeing. Where were people staying? Household waste is going up in a lot of places because people are at home, they're hunkering down. And honestly, what it turned out was a lot of those dark green areas were some of the places in the city that were hardest hit by COVID. Those pink areas, people did depart the city for other places. They might have had a lower caseload. Early on too, we were hearing anecdotally, like there were disparities as to who the virus was affecting, and what we were seeing in terms of who was showing up at the hospital, who was dying from this. The data was really particularly poor on this subject, especially in the beginning, but even now that problem persists. Roughly a quarter to a third of COVID case data in the US doesn't have race attached to it. So it's very, very difficult to say with any degree of certainty as to, who's really coming down with the virus. Part of that is just the bureaucratic overload and of keeping these papers. Certain hospital systems, certain pharmacy systems, testing locations haven't kept this data. So very early on, we wanted to look at disparities, but it didn't exist. We couldn't find it in the caseload data because of all of the missing values. We learned that death data was less likely to be missing racial and ethnic data, although it still is missing at some level. But we were able very early on to hand collect. The other thing is this data wasn't centralized in any place. So we had to hand collect and go from state to state and city to city to find out what the racial toll of deaths were. So this was a kind of mid-April look at the percentage of deaths. 75% of deaths in the District of Columbia were Black people, and the percentage versus the percentage of population. 45% of the population of Washington, D.C. is Black. So you can start to see that gap emerging, even though we don't have a full data toll yet, because that data hasn't been released by many states. And in this case, these were the only states and the only cities that were providing or releasing that data or even collecting it at that time. Since then, all the states have started collecting it, and the CDC has started collecting it as well. But at the time, this data was very hard to come by and had to, be manually collected from a number of different dashboards, state websites, state reports, and by calling and FOIAing different states and cities. But as we get into things like this, these disparities, you also have to keep some basic data, things in mind. Things like the Black population in the United States and the Hispanic population in the United States isn't of the same age as the white population in the United States. So then you have to move into like higher statistical, issues such as age adjusting your data. This is Connecticut was one of the first states that started looking at age adjusting its data. And when you look at the deaths, you see that the age adjustment makes a huge difference. Hispanics and the rate of deaths for Hispanics goes way up. The rate of deaths for Blacks increases even higher than what it originally was. And then the white death rate, because whites are typically significantly older, the white population of states is significantly older, drops significantly. So we have to kind of keep those kinds of things in mind. A death is not a death. If a bunch of 45-year-old Hispanics are dying, that might take more of a toll on a community than an several 80-year-old white people. So so that was something, and that work is honestly still going on to age adjust the death data to get a better sense of what each community's loss was. So another way into this, because as we were going further into, disparities and what the toll of COVID looked like on communities across the United States, how do you get into that into that story with the lack of data? One of the things that a number of news organizations worked on last year, and I thought it was a smart way to kind of walk around the problem a little bit, is looking at the issue of excess deaths, taking basically a baseline of deaths across the US or across each state for the last 3 or 5 years, and then measuring 2020's deaths against that to see what the discrepancies there are. And basically what you find is, the axis on this is basically the normal death rate. And so these peaks are above the normal death rate. And you can see the large disparities in Black, Hispanic, and Asian and Native American populations versus white populations. So it was another way, again, to get at the issue of what we were seeing on the ground as it was happening without having a full data picture, unfortunately, because, in a lot of cases, COVID wasn't being marked as the cause of death in a lot of these deaths. So that was really hard to get at. In a lot of cases, we weren't able to see specifically death certificates, or the death data was lagging by months for COVID deaths. So this was another way into what we were kind of seeing on the ground as it happened. A lot of people took different kind of slices of the excess deaths question last year to look at, places where they weren't reporting COVID deaths, basically, but also places just to track things like this kind of disparity among populations or in different states. This was a project we did at the AP. We did it alongside the Marshall Project. So we worked with them on this, and we broke it down by state and each different racial group. Another technique I think a lot of news organizations stuck to last year was hand collecting data. In the lack of with the lack of data about a certain issue, can we, create a survey methodology or hand collect data from enough places that we can tell stories around it? So this was something we did around schools. And, as schools reopened in the fall, as the school season started in the fall of 2020, what did it look like in terms of who was reopening and who was going back to school? We really wanted to see that. That's data in real time. The National Center of Education Statistics keeps this data, will have this data, but they'll have it in about a year and a half. And what we wanted to do was try to capture who might be affected by loss of learning, who might be affected by not having technology right away as it was going on. So this was our method to do that. We basically binned the school districts. They are binned actually in NCES data into 4 categories: urban, suburban, town, and rural. So we used those categories and we picked the 5 largest schools in each category in each state and sent them a survey and called them and followed up with them. And we ended up getting roughly 700 schools answering our survey. And we're able to then say, this was true. Districts serving mostly students of color were more likely to start online. It was true across every single type of school. It was true in rural areas as much as it was true in urban areas, or was true in rural areas as it was in urban areas. And, this was something, and it was a trend nationwide. We also were able to follow things like whether students had access to the internet, whether they were given computers or tablets to use, and things like that as well that ended up in other stories. So, collecting some of this data ourselves, I think a lot of organizations ended up doing that. We're just helped to fill in the gaps where we didn't have comprehensive, even state level or national data. The best example of that is the COVID tracking project. This was a large organizational project that was run from the Atlantic, and they were collecting test positivity rates. And at some point in the US, test positivity rates became a huge kind of metric of how states were doing and how localities were doing in controlling the spread of COVID. So test positivity became a huge policy issue. States were starting to decide on whether they were going to reopen certain things based on test positivity rates. The CDC was giving guidelines around what your positivity rate should be. And at the end of the day, what the COVID tracking project came down to was that test positivity was being measured radically differently from state to state and from locality to locality. So there was, one positivity formula that was set by the CDC, but in reality, what was happening was that there were 3 totally different ways of counting how many tests had been given, which is the denominator in any kind of positivity rate equation. So, what that created was then a totally unequal process where you couldn't measure one state's positivity rate or one locality's positivity rate against another. This was, hugely problematic, and honestly, was never solved, and really speaks to one of the biggest problems with the, entirety of COVID data across the last year, which is the lack of true equal systems to measure some of these things. I'm just going to go on for 2 more minutes. I wanted to talk a little bit about, as cases went up, there was a statistical need to kind of what I call flip the numbers. We were always measuring things per 100,000. So in Alexandria, where I live in Virginia, we have 14 cases per 100,000 people. That's a really hard number for people to understand. Like, how many does that mean in my community? What does that really kind of equate to? And flipping the number to this made it much more kind of grokkable for a lot of people. We ended up doing that in a number of stories. This is from the New York Times, but we ended up doing that in a number of stories that we did as well, where you flip it to okay, it's 1 in 15 people. And 1 in 15 is immediately understandable to folks. We did this with prison data that we were collecting by hand with the Marshall Project last year, and obviously got to 1 in 5 prisoners had COVID across in that year. So, which was significantly higher at the time than the US average. So kind of thinking about the numbers and how you can make them more understandable to folks is particularly important when you're dealing with these kinds of like ongoing big numbers that just keep on getting bigger. Finally, want to talk about vaccination tracking because we're kind of seeing all the same COVID problems again. Yet another data set that is problematic, being reported differently state to state. This is our COVID vaccination tracker. The Post is doing a heck of a job trying to track vaccinations across the US and where they're going. This is a labor of many, many people and is involved writing 50 state scrapers many times because the states changed radically how they were reporting the data many times, and then finally changing it to the CDC. And now the CDC has changed how they measure things several times. So, we do the best we can, but honestly, a lot of this COVID data as it's coming out is changing literally by the day. There's oftentimes new fields in the data each day from the CDC that mean different things. How do they track J&J, single dose vaccines versus double dose vaccines? What does that mean for people fully vaccinated or having received 1 dose? It's been a very difficult process and continues to be a very difficult thing to track all along. And so I will stop now so we can talk.
Thank you, Megan. Yeah, I mean, that was a really good overview, I think, of just how data journalists have been figuring out not just the scope of stories, but also finding untold stories and statistics during this pandemic and contextualizing them. In particular, I didn't realize until you mentioned it that you're right. Sorry. I had noticed, I think, in the back of my head, the flipping of statistics to make it more understandable. And it's good to hear from you how that was like a conscious decision or how thought was put into that at newsrooms. So yeah, again, Mark, Carol, and Megan, thank you for your presentations. We're now going to move into a more sort of free-form panel discussion time. And I thought I would kick it off with a question about, data presentation and how reporting during the pandemic has sort of really brought this intersection of science communication and news you can use, right, for the general public. So I think in some ways, the COVID pandemic has been a real crucible for the field. Mark, I'm curious, from the academic perspective, have you seen unique forms of storytelling or ways of presenting information from newsrooms that you're excited to maybe integrate into your lessons plans? But also conversely, have you also seen some real teaching moments where maybe something was confusing or reporting oversimplified important scientific details?
Yeah, I think so. I'm teaching a data visualization class now, and we have, one of the things we did was to go back over the year and just look at how the graphical forms have changed. At the beginning, it was, as Megan pointed out, lots of sort of exponential curves that fanned out in a variety of ways. And as I put in my presentation, various kinds of attempts at mapping and trying to just communicate scale. We spent a lot of time actually, a number of news organizations did some work around when the US hit the 500,000 number, trying to make that number relatable somehow. The Washington Post in particular had a kind of theatricalized piece that had people on buses, and as you scrolled, buses were going by, as you tried to count and you thought, well, this is impossible, this is never going to get us to the total. And then after a long period of scrolling, after so many buses, each bus had like 51 people on them, after like a minute of scrolling, you end up with 1 day worth of casualties, and then they flip over from buses to if you were to, all the buses were to be lined up on a street or on a stretch of highway from two familiar places like New York and Philadelphia or something. But the ways in which we shifted and the different strategies that went along to try to figure out, even just like getting the public accustomed to a log scale seemed like something that had to be talked about and thought about. And so yeah, there are a lot of teachable moments in thinking out how we kind of worked through and presented not only what we knew, but what we didn't know. Right, like where are the gaps, and sometimes, many times, the uncertainties that were present were not sort of statistical and couldn't be thought of in statistical terms. You just had to find some way to express what you didn't know. Yeah, I'll leave it there.
Thanks. And sort of zooming out into the journalism industry as a whole, Carol mentioned the need for journalist organizations to collaborate because of data issues. Carol and also Meghan, do you think that the competition versus cooperation, tension, do you think that will change the way media outlets are maybe working in competition with each other, but also together? And of course, Carol, let's start with you because I think in the US, we've got a very US focus, and I'm curious to see how this might play out in other countries.
I think this collaboration is something that we've never seen before, and I think there's a good side to competition because we actually improve everybody's coverage if we know that somebody else is doing something, that putting in an effort to doing something special. So we want to do that too. And also because we have so many stories out there that need to be told. And if everybody keeps telling the same stories, then there's a lot of stories that never get told. So the more variety and the more competition, the better. But we have seen a big collaboration and a growing collaboration, especially in data journalism, because doing data is very hard, programming and learning languages. So we do help each other. We have different WhatsApp groups with journalists that are covering the same thing. Obviously, we're not sharing our stories, ideas, but if somebody needs help using the database that I know how to use, they can just ask me and which field, which variable they need to use, and I'll let them know. So I think this collaboration only helps out, especially because the more people pushing for transparency, the better data we're going to have, and that's going to be better for everybody.
Thanks, Carol. Meghan, how about you? I know that the AP collaborated with you. Actually brought up collaboration with the Marshall Project, also with Shockbeat. Do you think that the COVID pandemic will be changing the way collaboration is done in media in the US?
Yeah, I think in the biggest sense of the terms, it really needs to move to a conversation of how do we all work together to verify and establish these basic data sets, right? Like we all kind of needed a lot of the same things last year. And we all spent a significant amount of time trying to get or build or maintain those basic things. Vaccine tracking is taking up a huge chunk of a lot of newsrooms' time and effort right now. So how do we best organize and make this a universal and singular effort? I think still needs to be worked out a little bit more, but we certainly moved much closer to, sharing resources, working together, things like that. The AP, we released a bunch of data sets for newsrooms to use, and made a lot of those completely publicly available. Some of them were just for our members, some of them were just for everybody, just to try to lower that bar to entry to just do the basic things. But there's a lot more effort needs to be made in this area. I think there could have been even more collaboration than there was in the last year.
As always, right? There's always more room for collaboration, less competition. Let's see. It seems like the audience is also interested in not just, right, so not just how thinking about how this experience might shape journalism as a field. So one of just thinking also about like how it's might be pushing innovation in data journalism as well. We've seen that some of the most effective cases for data journalism in the pandemic has been conveying and interpreting case counts. But what are some of the other big picture opportunities for data journalism as we move forward from the pandemic? Let's see, who should we start with? Meghan, do you have thoughts on this?
I actually thought Carol had a pretty interesting, I mean, I think, in many countries, we kind of had to be big advocates for public and open data. I don't know how much those arguments were heard, but I mean, what we saw was a lot of governments doing dashboards where there was no raw data behind the dashboards, or the raw data was inaccessible behind the dashboards. Tableau sites where you couldn't actually download the raw data from them, using a variety of different sites. Every state had their own dashboard. It was completely different. It included different metrics. So there was very little standardization around all of that. And yeah, the question does become like, where can data journalism become an advocate for standardization and organization of some of these things? I'm not quite sure where we fit in, but it certainly seemed like I would be interested in hearing both Carol and Mark's thoughts on this as to how we push for better, more comprehensive and more standardized data.
Thanks. Yeah, Carol, what do you think are the opportunities for data journalism in Brazil?
I think we have a lot of opportunity because we have a lot of room to improve. I don't know how easy it's going to be to improve because it's really, really hard. Like, for example, the testing data, there is a database. We could have the open raw data. We could see how many tests are being done every day and everything, but there is no data. And I tried for about 2 months in many different ways to get this data, and I asked in the press conferences when they were actually doing press conferences at the ministries, like, why don't we have that data? And they say like, oh, we can't put data with personal data from people up online. And I was like, I didn't ask for personal data. I asked for the anonymous database. You have it, you could do it, but you won't do it. So we actually have, we've had a forum of associations asking for more transparency. We have the Open Knowledge Foundation in Brazil. They actually had a ranking with different indicators of transparency. That actually helped a lot of local governments, state level governments, improve their transparency because of these indicators. But that also had a backlash. So there was other states or cities that took back on their transparency levels because they looked bad on some rankings. So they said, oh, I'm just not going to do anything for them. So that we've seen both things happen. I think that Sean had a question here on the Q&A that I think kind of matches this. I think that as we are able to automate the data that we have and try to find ways to get that data quickly turned into information that we can use in journalism, I think we start advancing naturally, and then we can try and get like, why don't we have that data in this format? So we can do that with that sort of data as well. And what we can do as well is we can, I'm going to use this word, but I don't know if we can arm the reporters and the editors and the people that are interviewing the authorities with this data fast, so they can try and fact check in real life, in real time, when the authority says something. And then if I hear someone say something, I know the data and I say, no, that's wrong. And then I can quickly inform the person that's there in the press conference, like, that's not correct. And then they can question them in real time. And so this is a way that we can use data as, I'm going to use the word weapon because I can't think of any other word, but I don't think it's a war. I think society is only going to improve with this, but it's as a weapon to tell the authorities that they can't push certain narratives just the way they want to, because the data will help us not allow that to happen, or at least we can show both sides and keep the public informed. And I think the public pressure is the one that also helps get authorities to actually comply to laws, because we have transparency laws that people are abusing or ignoring nowadays.
Wow, I think I know someone had also asked in the Q&A about impact, and I can't think of a more sort of direct form of impact than being able to question authorities in real time about the information they're presenting to the public. And so, okay, thank you for your perspectives, Meghan and Carol, on how newsrooms, how the field is changing in newsrooms. Mark, you know, this also extends into academia, because the Brown Institute, for instance, supports innovation in media. And you mentioned these grants specifically geared towards COVID projects. You know, how has the pandemic changed the way academia supports innovation in media, and especially data journalism innovation?
So, I mean, you know, we had a lot of programming set up for 2020 because it was going to be the year of data, right? It was the 50th anniversary of Earth Day, so you have climate change you can talk about. The Olympics were going to happen. The census was happening. Like it was just just bristling with data opportunities and to bring in new stories, and then the pandemic happened and everything focused on that. I think one of the things that that at the core, like, so I get asked to teach statistics in the J school from time to time in reporting classes or whatever. And so, you know, using COVID as a backdrop is an interesting angle. And the issue is that if you want to touch any epidemiology, you're almost immediately hit with a partial differential equation, and the students go, and so you don't kind of want to go there, but what it suggests is that, or what we've started to think about is that maybe it's suggesting having sort of a tighter bond rather with sort of experts, whether they be epidemiologists or other sort of technical people in the technical field, and not just have them appear in the publication under the opinion pages, which is where a lot of people present their research, and not just have them quoted as a source, but have them as collaborators in building up stories and sort of creating a kind of shared language. A second thing that we've been looking at Brown is ways to try to bring more undergraduate STEM students into journalism, right? So that you have a basic kind of sort of data and sort of modeling awareness coming into the journalistic practice. And something really interesting happens when those two work together. One of the projects that I mentioned, the documenting COVID-19, is pulling all of these emails from local and state health departments and governments to try to see who knew what when, right? And to take all of that, to create timelines, to think about, you know, what data sources are sort of implicit in here that we can start to tease apart to tell a story. The team has been really successful in bringing on not just sort of investigative journalists, but also students from our dual degree who are both journalists as well as computer scientists, who have the capacity to ask questions of the data on their own, but then also answer them on their own, and then work in a team. So I think this goes kind of back to your collaboration question a bit, but collaborations sort of outside of journalism and also sort of helping to kind of advance the field by bringing in students who have more traditional STEM training.
Thanks. Great to get perspectives from both newsroom and also in academia. Let's see. So I think we've got time for one more question with input from everyone. Perhaps the most broad question I've seen all day about data journalism, especially in the context of the pandemic. What would you all say have been the biggest technical challenges to data journalism, but also the biggest social challenges? It's been a pretty roller coaster year all around the world in terms of not just the pandemic, but also politics, social conflict, stuff like that. So
I think she froze.
Yeah, Irena, we can't hear you if you're still talking. You can type the question. If you're still present, you can type the question in.
Maybe you could.
Well, while Irena comes back from her technical difficulties, Meghan, would you take a shot at the social aspect of the question Irena just asked?
I do think there's been a challenge, and as Mark said, just training people to understand some of these visualizations and terms and things we were throwing at data this year. Things like a log scale, things like excess death calculations. These are complicated ideas that the average person isn't familiar with, and it's literally are kind of some of our only ways into measuring what's happening. And so, we saw a lot of really good, I think, very high level step backs in terms of walking people through some of these types of visualizations, some of these types of models. I honestly thought some of the best and most successful data journalism of the year were things that stuck with extremely simple idea, and that also took a very high level look at what was happening, because the daily, shuffle and the daily, increases and where caseloads were and things like that was an incredibly hard thing to just kind of keep a thumb on. So where we did well is in slow down, let's explain this really closely. I thought, El País had a great explainer in the fall about how coronavirus moved through the air. And it was a fantastic step through with visualizations. It was very data driven in the sense that they had clearly done the math behind it. It didn't show up as a data story. It was literally like, here are 3 scenarios. You walk into a bar, you walk into a friend's home, things like that. And here's what your chances kind of are because of, issues like ventilation. So when you're talking about, how we express things, I think it's upon all of us as data journalists to kind of take a really slow look at, can we step back? Can we simplify this? Can we explain this to people, in a very logical and kind of, coherent way, at a very high level, so that they're going to understand not only this graphic or this story, but also stories going forward on this subject.
Thank you. That idea of making things tangible through simulations is, I think, an aspect that has thrived in particular parts of the reporting, but it's not prevalent everywhere yet. So I think that's really important. Carol, do you have anything to add there?
Yeah, I agree with the simplicity factor. Before the pandemic, 2 months before, I switched from online news to television news, and it's very, very different. And the audience is also very different. Before, on online news, you have someone who wants to click on the story and they can read the whole story, or they can read only a part of the story. They can spend 2 minutes reading it, or 5 minutes reading it, or 30 seconds reading it. But on the television, when it goes on television, you have your graph. A person is going to look at it in 10 seconds, so they have to understand what's going on. So it's a very difficult process to simplify the information in a way that the audience can understand in such a quick way. And it's also, I think it's a challenge, and I learned a lot from it doing television with the editors, because they have a very hard job in translating all the data and all the information into something that you can watch with your eyes and you can be informed by it. And they only have 2 or 3 hours to put the story together, so it's very demanding. But also the audience is a lot broader, so it's the people that go out, that have had to go out and take the bus to keep working because they don't have any other way of supporting their families, so they have to risk themselves. There are people who are living 6 people in the same household, 3 generations. They have to protect the elderly that live with them. So these are the people that are most impacted by the pandemic. So talking directly to them is pretty much a privilege. So I don't really get frustrated if I think like, oh, I'm gonna do this beautiful graph and like a flow chart or a box plot, and I can't do that because I can only use bars or lines. But I know that that's the way that I can communicate that information. So I think that's the most important thing of our job. So I don't get so frustrated about that anymore.
Well, thank you. Thank you. So Mark, I guess maybe we'll give you the last word, and something that, so do you have any thoughts on, so we have science here, we have communication and journalism. How does that all wrap up to communicating the emotional impact of what's happening? What's the challenge for the scientists?
Right. So emotional impact is an interesting one, right? So the I'd mentioned, for example, the Washington Post piece with the first with the buses. You should have a look at this work, but first with the buses, and then stretches of if you were to line all those buses up to try to give you a sense of what 500,000 people, like what does the number 500,000 mean? And I'm not sure that emotion for emotion's sake is what we're after. What data journalism does provide, though, is an opportunity, if it's there, right, to think through what's the data source that you're going to look at to capture a particular situation. I mean, Meghan already mentioned like the emptying out of Manhattan and how we might like pick a data set to portray that, right? And so there's in the same way that a good journalist picks their sources, a data journalist would pick their sources. There's almost I don't want to say aesthetic, but there's a quality there that will speak to people in ways. So it's not just how it's presented, although that's important, but it's also what data have you chosen to help portray that particular situation. And I would say that at the end of the day, especially with COVID, I feel like our responsibility is to help people make better decisions about their actions, about the health and well-being of their families as a result. And those stories then, I think the note that I wanted to end on was a statistical one, which is those stories have embedded within them uncertainties, and being able to communicate, I mentioned this before, but being able to communicate honestly what you do and don't know, so that people can, make appropriate choices, can hopefully make a better informed choices. Because again, the data, as you've heard, the data are in various formats. Some of the numbers that were quoted or that we keep using don't make any sense, right? Like the proportion of vaccines or the proportion of tests that are positive doesn't really tell you much, because you don't know what the downstairs, like what's affecting that from day to day and who's showing up to get tested and all of that. So, okay, if that number's high and these other numbers are high, then yeah, okay. So maybe it says something bad is happening, but like we're constantly sort of making these sorts of trade-offs. And I think the sources of data are one thing that a journalist can look to and sort of be creative about to help make it real for people.
Well, thank you. So, Irena, you're back. So you do, in fact, get the last word. Do you have any wrap up that you'd like to leave us with?
Thanks, Joe. Yep, I'm on my phone. Thank goodness for cell towers, even when electricity or the internet goes out. Yeah, I just want to thank Meghan, Carol, and Mark again so much for taking the time to chat with us. And the audience for taking the time to listen to this about data journalism. It's one of the best things in the world, and hopefully you do too. And I'm gonna hand it back over to Joe announcements. And also one of our audience members that give interest to others in this talk.
All right. Well, thank you. That's it for today. We really appreciate the time and the expertise of our speakers. Thank you for the audience for your willingness to be here and for putting up with our minor technical glitches. Please watch the website, the COVID Data Forum website. That's COVID-19-data-forum.org for information about when the video for this conference will be available and for upcoming events. So thank you all. Please stay safe and take care.
Thank you. Bye.